All right. And with that, I'm going to go ahead and get started. So thanks everybody for joining us today. My name is Jeannie Castine, and I'm the Executive Director with Secular AZ. As you all know, white Christian nationalism is the greatest threat to our democracy, and Secular AZ is your voice for the separation of religion and government. We are a nonprofit organization, and we act as your voice to elected officials all across the state and at every level. So be sure to check out all of our social media channels and like, subscribe, and share. Early primary voting is happening right now, but just so you know, it is too late to vote by mail. So be sure to find out where you can drop your ballot off and get it in as soon as possible. Next week, we're going to be speaking with Mary Beth O'Connor. In her memoir, From Junkie to Judge, One Woman's Triumph Over Trauma and Addiction, she shares her inspiring secular recovery journey from rock bottom to resilience as she forged a personal path to recovery from trauma and addiction. This book is the winner of the Silver Award 2023 Nonfiction Book Awards. And I saw Mars is on here, and I'd like to give Humanist Society of Greater Phoenix a shout out because they do have secular recovery groups there. So if you're interested in finding a group that doesn't, rely on the belief in a higher power, there are groups out there for you. But for today, we are talking with Jessica Edmonds. She is a licensed family practice nurse practitioner, certified as a gender care provider with the World Professional Association for Transgender Health, also known as WPATH, and as an HIV specialist with the American Academy of HIV Medicine. Jessica is originally from Indiana, where she worked with the state's first family medicine practice to be openly accepting of LGBTQ plus patients. Jessica's passion for this work has really ignited during graduate school while attending Indiana University South Bend. She was instrumental in ensuring the incorporation of transgender and gender diverse healthcare into the curriculum for nurse practitioners. She recently launched a telehealth practice focused on gender-affirming care, HIV prevention, and HIV management called Gamut Health. And I actually crossed paths for the first time with Jessica, at Phoenix Pride. And we happened to be across from each other, and they just had such great information. So we were able to connect. And Jessica, I'm just really, really glad that you're here today because there is a lot of mis and disinformation. So I think we're all ready for you to drop some knowledge on us and help us be better allies.
Okay, yeah, I'll do my best, and hopefully I'll be answering some of the questions. I think because I wasn't 100% sure who all my audience would be and their level of knowledge when it comes to transgender individuals, gender diversity in general. I decided to make this a little bit of a 101. But thank you so much for having me. I really appreciate it so much. I appreciate everything that y'all do.
Sure. And real quick, would you like the questions as they come, or do you want to wait and hold them off? Because I will watch the chat for you.
Maybe let's hold off just to the end and then
Okay.
and then have sort of like a question and answer session at the end. That would probably be best.
All right, sounds great. Take it away, Jessica.
Okay, great. I'm gonna go ahead and share my screen. And then let's share. And then just let me know if you see that. Is everything working okay?
It's looking great from my end, Jessica.
Okay.
Go ahead.
Okay, great. Thank you so much. All right, so I'm going to be talking about gender diversity. Like Jeannie mentioned, I am certified with the World Professional Association for Transgender Health. I'm also an HIV specialist, and I've been doing LGBTQ plus care since 2015. And so I wanted to start with just the basics in terms of definitions. Because I think this is a key part that is really crucial to understand, and especially when we're looking at laws and bans and things that are happening, understanding that biological sex and gender are two different things. So biological sex, as a definition, is a label designated at birth based on genitalia and the presence of XX versus XY chromosomes. And for the majority of people, that aligns, their biological sex may align with their gender. However, gender is not exactly the same thing. Gender is a social and legal status, a set of expectations, behaviors, characteristics, thoughts, and feelings associated with identity. And there is no, and also then let's go into sexual orientation. Also not the same as gender. Your gender does not dictate your sexual orientation, or vice versa. It is something separate. Sexual orientation is an enduring personal pattern of romantic and or sexual attraction to persons of one or more particular sex or gender. And you really will not find a textbook that is taken seriously in the medical community on this topic that does not make the distinction between these three things in this day and age. So biological sex does not always dictate a person's gender. And so more definitions. So transgender, or being gender diverse. So having a gender that does not align with the sex that was assigned at birth. And then cisgender is a person who has a gender that does align with their sex that was assigned at birth. And so going on, so as long as there has been history, we have had persons who are transgender and gender diverse recognized. So since time immemorial, Indigenous peoples across the globe have recognized gender diversity as a natural and often celebrated, and they often celebrated their transgender and gender diverse community members. That is until their colonizers arrived and enforced strict gender roles while purging native cultures. So we see in South Asia, the Hijra were a third gender recognized for thousands of years. They were held in high regard for thousands of years, and ancient texts describe the Hijra as bringing luck and fertility to society. Native Americans throughout the centuries have also recognized alternative genders, and the term two-spirit is what's used more in more modern times, that recognizes those carrying both male and female spirits. And so the terms that were used throughout, throughout history and the roles that were carried were unique to each specific tribe and its cultures. And the Navajo tribe specifically, they had up to 5 genders that they recognized in their culture. And gender non-conforming persons were often seen as regular members of society, if not elevated, and oftentimes throughout history are just seen as a normal variation of what it means to be human. So throughout history, we see transgender and gender diverse persons recognized in various cultures across the world. And so these are just some examples of cultures throughout the world where gender, where third gender or fourth or fifth gender even, was recognized, and gender was not binary. And so you have transgender individuals like the Gala of ancient Rome, Mahu in society in Hawaii's history, Fa'afafine in Samoan culture. I would highly encourage you, if you want to take a screenshot of this and just look into any of these cultures. It's very fascinating to learn the histories. But oracles, the Kwariwarmi shamans of the Incas. In Mexico, you have the Muxe. The Bugis of Indonesia recognize 5 different genders throughout history. Katui of Thailand, the Feminelli of Naples. I mean, on and on and on. Honestly, we're seeing transgender individuals. This is not something new. This is not something that just came about. And, in our Western cultures, the fact that we're seeing more transgender individuals coming out is not because there are just more present now. That is unlikely. It's really just that as things have become more accepting throughout the decades, more people are finding the courage to come forward with who they are. And so what we really want to do is look at biology as well, and realizing that gender and what defines gender, what determines gender, is not as simple as XX versus XY. So again, going back to what I mentioned before, there are many people with XX who their gender aligns with being feminine and taking on those roles and those behaviors and those characteristics in their society. But there are those that does not align. And the same with XY. There are plenty of persons who are born XY who can comfortably, move into those roles and have those behaviors and characteristics and patterns that align with the masculine, but that is not everyone. And so when we look at the brain, studies assessing the brain and staining patterns, actually many studies. So there are studies that assess staining patterns, MRI imaging. There are neuron numbers and limbic nucleus that have been assessed, neuronal pathways that have been assessed that show that transgender brains are different and often align with the gender that they know themselves to be. So they will align with what we're seeing so if someone is a transgender woman, their brains align more with a cisgender woman, especially in areas that determine gender. And so just, throughout history, some of the things that we've seen where we've had psychologists or psychiatrists who were convinced that gender was just based on how you were raised and based on social conditioning. Dr. John Money was one of these physicians who believed that nurture could supersede nature, and he decided he was going to do a study on these identical twins. One of the twins had a penis destroyed in a botched circumcision, and he decided, okay, this is a perfect place where I can, prove my point. And they had done a surgery to make the child female and raise the child as female, as a girl. And then initially, John Money thought that this was a success, but as soon as David Reimer, who is the individual who was raised as a girl, was told at the age of 14 about his history, about his medical history, he confessed that he was miserable as a girl, and he immediately went back to being a boy. And then he went on to become an activist against the notion that gender could be imposed on a child through surgery and parenting. He described the experiment as a living nightmare and eventually took his own life in 2004. And so other things, to talk about and see or think of when we think of biology, we do know that testosterone levels and estrogen signaling in the brain in utero has a correlation to a person's gender identity. We do see that if someone who is XX has a high level of testosterone in utero during brain development, that they are more likely to be transgender and identify as a male. And then the same thing for XY. If there is a lower level of testosterone, then we do see that there's a higher rate of an XY person identifying as female. And then understanding intersex persons. There are more people who are born intersex than there are people who have red hair. And the ratio of intersex persons who then will identify as a gender opposite to what their chromosomes say is much higher. And we also see that with congenital adrenal hyperplasia, which is one of the leading causes of intersex. And so the general population, it seems that there's about 1 to 2% of the general population identifies as transgender, compared to in CAH, we'll see about 12% of those individuals identify as transgender. And so when we look at genetics, so multiple studies have now found that versions of different genes to be significantly overrepresented in transgender women compared to non-transgender males. And these are genes that control sex steroid signaling, especially just before and after birth. And so it's a much, much, much more complex interplay of hormones and receptors and genetics and anatomy that plays a role on a person's gender than what I think a lot of times in mainstream society just saying, okay, well, you were born with a penis, therefore you are a boy, and you were born with a vagina, therefore you're a girl. It is so much more complicated than that, and the brains and the biology demonstrate that that is not always the case. So the other thing that kind of points to the genes and DNA playing a role are twin studies. So when we look at fraternal twins versus identical twins, for fraternal twins, if one twin is transgender, then there is a 2.6% chance that the other fraternal twin will be transgender. And so fraternal twins do not share identical DNA. However, if the twins do share identical DNA, then the likelihood that one twin, if one twin is transgender, the likelihood that the other twin will also be is about 40%. And so that speaks volumes about the fact that gender identity and our genetics do actually play a big role. The genetics do play a big role in our gender identity. And the same thing when we look at XXY. So with Klinefelter syndrome, there's a much increased likelihood of being transgender when you have an extra X with your Y as well. And then I just want to so Joshua Schaefer is an endocrinologist who is an expert in the field and an executive at Mount Sinai, who has a lot to say also on this topic. So I'm gonna.
And Jessica, I'm just gonna let you know if the sound doesn't play, it's probably because you have earbuds in. So
Oh,
if you could perhaps
Yeah,
switch like the output real quick? That's one
yeah.
we have struggles with the sound. So
So
yeah,
am I able to do that while I'm sharing my screen
I
oh,
believe
here,
so. I think what you should be able to do is go to the little microphone symbol and
I
then,
found it.
yeah, go to,
Thank
yes,
you.
got it.
Very good.
Yeah.
Okay, so is it for this the speaker or the microphone? Would you
That I'm not going to be able to answer. I would say probably same
the
as
microphone? I'm just gonna do both.
give it a shot, see what we got.
All right, yeah, and then let me know. Please interrupt me. Let me know if you
Okay.
don't.
I'm not hearing sound. So even maybe if you just power them off and then your computer will automatically do it. Sorry, folks. And then I'm just gonna go catch up on the chat real quick,
Yeah, yeah.
and I'll
So
let you know if I can hear it. Yeah.
you're saying that if I just switched it over, and so now it's coming out of my speaker.
Give it a shot.
Yeah.
There we go. We can hear it. Oh
Okay,
wait,
perfect.
there we go. We can hear it.
Intersex children seem to confirm that gender identity is biologically predetermined and cannot be manipulated.
This study is David Reimer on steroids.
16 children were born with a rare intersex condition. While they had XY chromosomes and were genetically boys, they were born without penises. Most had vaginas surgically constructed and were raised as girls. Despite the surgeries, 4 of them insisted they were boys. 4 others initially lived as girls.
But when those kids learned what their medical histories really were, they decided, oh, that explains a lot. I know you've given me a girl's name and dressed me in pink and given me a vagina and are giving me female hormones and puberty, but actually I'm a boy.
Ultimately, nearly 2/3 of the children felt that regardless of their external genitalia or how they were raised, they were boys. What happened to the remaining children? We don't know because the study ended. But it was enough to convince a lot of doctors, including Joshua Safer.
So this is not just one individual who was treated unfortunately by the medical establishment, but a whole group of kids.
We know that scientists believe that something happens to the trans brain while it's developing in utero. But there's also some evidence from human brains examined post-mortem that seems to show trans brains are in fact different. And ground zero is the hypothalamus, the tiny nerve center that controls your heart rate, sleep, and metabolism.
Down below, we have the staining pattern of a gay man. The picture above is the staining pattern of a straight man. And observe, there is no difference between the gay man and the straight man. However, over here in this corner, we have the staining pattern for a transgender woman. She has the same staining pattern as the non-transgender, as the cisgender woman. And there are areas in the brain that correlate with gender identity and not with external body parts.
Okay. I'm gonna put these back in and see.
Yeah, go right. If that's the last video you have, then it should work. Just make sure
Okay,
you
yeah.
can
So
hear
were you
us.
able
Okay, good.
to hear those videos? Okay.
We were. Thank you so much.
Yeah, of course. So yeah, if you heard that, that was actually Katie Couric, and that was interviewing with Joshua Safer, who I said is an endocrinologist, and he is also part of the Endocrine Society. And yeah, just going into some of these things that we are seeing with our transgender individuals and the biology. So the sad facts, unfortunately, are that persons of transgender and gender diverse lived experience have higher rates of depression, anxiety, and suicidal ideation. And these disparities are generally thought to be due to 2 processes. So one, the dysphoria related to one's body developing in ways that are incongruent with one's gender identity. And I will tell you, and I can testify from children to adolescents to adult, that this can be extremely distressing and devastating and cause a great degree of depression and anxiety and self-shame and increased suicidal ideation, as well as, of course, gender minority stress in the way that the society as a whole, whether their network, their family, their friends, their school, yeah, or their larger communities do not accept them, and the discrimination that they face, and also potential violence that they face. So suicidal ideation. Now, these numbers are absolutely unacceptable. So suicidal ideation, 82% of this population has considered killing themselves. But now when we go beyond just thinking about it and talking about suicide attempt rate, the general population has a suicide attempt rate of 2.7% for adults and 8.9% for adolescents. Transgender population, that number jumps to 41%. And for trans communities of color, it's basically half of that population. So nearly half of the population of transgender community has attempted to, either has attempted or successfully killed themselves. And this is entirely unacceptable. And like I said, it goes back to those two things, the dysphoria related to the body, every day living in a body that is incongruent with, you know, who you are. And then of course, the level of acceptance or unacceptance. And when we talk about children and youth, this is really, really, really sad. So when we have kids who are as young as 9 who have died by suicide because of their gender dysphoria, we need to wake up and say, oh my gosh, what is going on here and how can we help? You have kids who say things like, Mom, I'm not a boy, I'm a girl in my heart and my brain. I've had kids who, they're just so confused. They're because they know who they are, and they know, you know, I've had a little girl who just doesn't understand that her friends are all telling her that she's a boy, and she's like, why are they saying this? I'm a girl. I've been a girl. I've always been a girl. I'm always going to be a girl. Understanding that trans youth are actually 8 times more likely to kill themselves compared to their cisgender peers. It's unacceptable, and it just profoundly sad when you hear children, much younger children even, talking about not wanting to live if they're going to have to live in the gender that they were assigned, talking about wanting to kill themselves if they have to live in the wrong body, and asking things like, when I die, can I come back as a girl? Or if they were born a boy, I'd rather be allowed to be a girl than have friends when their friends are not accepting in their kindergarten class or their first grade class. And then when they learn about puberty, the distress that comes with that, screaming, crying, panic attacks, I can't get facial hair, what if my voice gets low, and people know, things that cause a lot of distress. And understanding that puberty, so doing nothing is not a benign choice. So if you are a girl, and especially as a young girl, the idea of growing facial hair and having this masculine bone structure and this body hair is terrifying and is devastating when it happens to you. I guess I could be vulnerable here. I have hirsutism, real bad hirsutism, which I have to get electrolysis for, and I could grow a beard. And the idea of me presenting out in public with a beard is absolutely devastating to me, and would if I had that or was forced to sort of live with a body that presented in that way, I would be so depressed, and I would be miserable, and I would be angry that anyone would force me sort of into that. And so understanding that puberty blockers, so doing nothing is not a benign choice. Puberty blockers are safe and reversible. This is hitting the pause button. We have been using puberty blockers for almost 50 years for precocious puberty, and has been considered by the medical community at large, and with all the research that we have, when it's used appropriately, that it is safe and it is effective. And we continue to use that for precocious puberty, which is when children who are much too young to be starting puberty are starting puberty, under the age of 8 or 9 starting puberty. And so we push pause because we say, nope, not yet. That's not a good idea. So push pause and allow them to go through puberty in line with their peers. And so puberty blockers are what we use then for transgender kids to push pause or to stop this from happening. So if you are a transgender girl, to stop some of these effects that would be absolutely permanent, what the changes in the bone structure, the facial hair growth, these things are permanent. The drop in the voice, those things are permanent. And of course, as we know, into adulthood, someone who is whose gender is female, who has these characteristics, whether it is the the jaw, the facial hair, the bone structure, things like that, regardless of everything that they do to try to cover that, they get what we call clocked. And then it's not as safe for them, especially in the society that we are currently living in, where there are too many communities and too many places where people are not accepting, and some people are ignorant and violent even against these individuals. And so that's scary. So it's not only scary to look in the mirror and just live with yourself, but it's also scary to go then out into public where you are not necessarily safe. And that also just contributes to the distress and the anxiety and the depression, and certainly the suicidal ideation. So doing nothing is not a benign choice. So I'm gonna move on here. So anyway, so the evidence. So evidence, there's extensive research and studies that have been done and have repeatedly found that gender-affirming medical care results in reduced suicidality as well as improved functioning and well-being. And I will say for persons who are involved in this type of treatment, or healthcare providers and professionals, experts and mental health professionals who have been caring for this community, it's amazing to have all of this research and all this evidence, but of course you see it every single day for yourself. And I will tell you from my own experience, when I very first started this work back in 2015, 2016, somewhere around there with Mosaic Health and Healing Arts, we were in a very religious, very right-wing conservative community, small community in Indiana, Elkhart, Indiana. We were renting space out of a mental health facility. And I remember thinking, as we started doing this work, first of all, when we very first opened the doors as the first LGBTQ plus accepting family medicine practice, people would say things like, "Oh, are you going to have any patients?" As if they didn't exist here or in this area. Well, not only do we have patients, they were coming from all over. They were coming from Ohio, they were coming from Michigan, they were coming from Southern Indiana to get this care that they so desperately needed, that they did not have a safe and accepting place to get this care. And in the process, I remember thinking, because a lot of these patients are coming in on anxiety medications and depression medications, and they have these issues of anxiety and depression. And I thought, surely now that you will be transitioning in a community that does not accept you, or to family members who may then shun you, or friends who you may lose because of this, surely that could increase your depression and your anxiety. And what I found consistently was the opposite. What I found consistently were patients and especially some adolescents who would come in who would barely look you in the eyes, very shy, and weak and depressed. Then 6 months down the road, 9 months down the road, when their body started transforming to be more in sync with who they knew themselves to be, when they would look in the mirror, they came in bouncing off the walls. I mean, they were coming off of their depression medications, they were coming off of their anxiety medications, and they were this person that I didn't realize was in there. They were outgoing, and they were happy, and they were excited, and they were thrilled with the changes. And I can't tell you how many times I've had patients throughout my work in all the places that I've worked who have said that this care saved their lives, that they would not have been able to survive without this gender-affirming care. So first of all, and based on all of the evidence, so based on all of the research that has again and again and again found that gender-affirming medical care reduces, suicidality and depression, and is safe and effective, the American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, the Pediatric Endocrine Society, among others, have all come out and said just that they have found gender-affirming medical interventions to be safe, effective, and proven to save lives. And this was not so much debated until more recent years, when it has become ultra politicized, and there have been a lot of sort of shady tactics used to sort of put this in question, and especially being promoted by people who do not do this care, who do not know these individuals, and who are not a part of this community. So anyway, so going on from that, so a 2022 study found that suicide risk was reduced by 73% in transgender non-binary use of gender-affirming care. and understanding the rates of regret. So the rates of regret after gender affirming care is less than 1%. So after 5 years of social transition without any medical affirming care, but kids who socially transitioned, 97.5% of those youth remain steadfast in their gender identity. And then when we look at the ones who did get gender affirming care, again, the regret is less than 1%. And only 2% of persons who identified as transgender initially later conform with the sex assigned at birth. And detransitioning does not equal regret. And there's actually been studies that were done on reasoning for persons who detransition. And again, detransitioning, talking about 2% of this population. A lot of times they're listing things such as, sort of pressure and societal pressure to detransition. It was just easier for them to sort of live and work in the society that they lived in. So they decided to detransition. And then others mentioning things, rationale related to religion. And so again, detransition does not equal regret, and the rates of regret are far lower than what we see with a lot of other medical procedures and surgeries and things that we do, like knee replacements, for instance, have a regret rate of up to 30%. And we still do knee replacements for the 70% of people who we know that it would really benefit. And then when we talk about rates of regret, and also when we're talking about children and performing medical procedures on children, intersex children are often operated on without their consent. Obviously, they're babies, and that decision is made by the doctor and the parents. And they're about 20% will grow to regret whatever decision their parents had made on the surgeries. And that's a whole other topic and a whole other discussion in PowerPoint that we could go into as far as the horrors of doing surgery on babies and children when it really should be their decision. And when we talk about the care that we provide as medical providers for adults or for youth, we follow the standards of care. This is the World Professional Association for Transgender Health. And these are persons who are persistent, consistent, and insistent. That's part of the criteria to be a candidate for medically affirming care, talking about starting hormones or even talking about surgery. So the adolescent meets the diagnostic criteria, which I'll go over actually in another slide right after this. That would be like for the ICD-11, which is the DSM-5 criteria. And then the experience of gender diversity or incongruence is marked and sustained over time. They are persistent, consistent, and insistent. The adolescent demonstrates the emotional and cognitive maturity required to provide informed consent for the treatment. Before treatment is given, the adolescent's mental health concerns that may interfere with diagnostic clarity, capacity, consent, and gender-affirming medical treatments have been addressed. The adolescent has been informed of not just of the reproductive effects, they've been informed of everything, the pros, the cons, the risks, the benefits, fully informed consent is given. And if there's any potential loss of fertility, which is also a little bit controversial because we're realizing that plenty of people can go on hormones for even long periods of time, go off of them and still have their own biological children. But just because fertility may be impacted, we make sure that we talk about that and talk about even freezing sperm or freezing eggs. And then the other thing to keep in mind, the adolescent has to have reached at least Tanner stage 2, which means we are not doing any medical care on children younger than the age of puberty. Then puberty has started. So anyone before puberty, the only transitioning that is happening for those children who are persistent, consistent, and insistent about who they are and what their gender is, they are not getting medical treatment. They are transitioning with clothes. They're transitioning with their hair, with their name, with their pronouns, what makes them comfortable, what makes them happy, what gives them a good quality of life, and keeps them from these distressing panic attacks about being the wrong gender. And so only once they've reached Tanner stage 2 and have begun to show the beginning signs of puberty are we going to talk about medical intervention. And those conversations may include blocking, using the pause button, using puberty blockers to stop the horrendous catastrophic effects of sex hormones, especially the catastrophic effects of testosterone, because that is a lot more difficult to undo. It actually cannot be undone in a lot of ways. And you can do that. You can pause and you can wait, even up to a couple of years before then deciding, okay, do we still want to continue with this transition and give you the correct puberty with the correct hormones according to your gender? Or has the child then decided, no, I'm comfortable, I'm okay, let's allow my natal puberty to take place, and then you stop, you take away the blocker, and then natal puberty takes place just in the same way that it does for the patients who have precocious puberty, who we use those same puberty blockers for and have done so for almost 50 years. So the DSM-5 for adolescents and adults, there are some things on this that I think in the future some wording that will be changed that's not quite appropriate, but by and large, this is what we use, and this is what we have to use. As for the diagnosis, there has to be a marked incongruence between one's experienced expressed gender and the primary or secondary sex characteristics. So a strong desire to be rid of one's primary and or secondary sex characteristics because of a marked incongruence with their experienced expressed gender, or in young adolescents, a desire to prevent the development of the anticipated secondary sex characteristics. A strong desire for the primary and or secondary sex characteristics of the other gender, a strong desire to be of the other gender or some alternative gender different from one's assigned gender, strong desire to be treated as the other gender or some alternative gender that's different from one's assigned gender, and a strong conviction that one has the typical feelings of and reactions of the other gender and some alternative gender different from one's assigned gender. So something that I really do want to mention again is we're talking about persistent, consistent, insistent when we're talking about gender identity dysphoria and even considering medical intervention. There is no such thing as rapid onset gender dysphoria. That's not something that is considered, and that's not something that gets medical treatment. And so when you hear that being discussed or being said, that gender affirming providers are just allowing anyone who comes in and says, okay, now I've decided that this is whatever because I saw, a video on YouTube or I did something on Tumblr, that's not considered, and that's not something that we're doing. So, and there is no such thing as rapid onset gender dysphoria. So those can be a little bit more complex situations, and certainly, those patients we're going to collaborate with mental health and see if there's something that's going on that's been going on versus something that's not going on. And we are not just giving all of these children hormones and surgeries. So for children though, it's very similar, but it also just goes into talking about, a strong preference for cross-gender roles in make-believe, player fantasy, and that is so common. Toys, games, activities, stereotypically used or engaged in by the other gender, so on and so forth, as you can see. So these are the criteria that we use as medical professionals for giving a diagnosis, where a diagnosis is required to be given. And then, so understanding, so when we have decided that we are going to proceed with hormone therapy is often safer than hormone therapy that we use in cis care. So I am actually a little bit more nervous as a healthcare professional to be giving someone estrogen or estradiol who has ovaries and is making a lot of their own estrogen or estradiol potentially, or the same thing for testosterone and someone who has testicles who's making a lot of their own testosterone. That is much less safe. And also when we're talking about oral contraceptive pills, because that's a synthetic form of estradiol that we know has a much higher increased risk of heart attack, stroke, and blood clots, as well as potential increased risk of cancer in these synthetic hormones that we're giving all day, every day in oral contraceptive pills to cis women. Compared to what we use in transgender care, which is bioidentical hormones. By and large, we're using bioidentical hormones. And we're just bringing those levels to cis values. So for a person who is a transgender male, we're bringing the testosterone within the range of someone who is a cis male, whatever that testosterone range is supposed to be. And so the same thing for our transgender women, we're bringing their estradiol levels into the normal level of what it's supposed to be for a cis, what the reference range would be for a cis woman. And so what we see is many of those risk group patients are just swapping. So when you have a difference in cardiovascular disease risk between cis men and cis women, then a transgender woman and a transgender man will swap those risks. Maybe some will get a lower risk and some will get a little higher risk. Same thing for osteoporosis. Osteoporosis for cis women is higher compared to cis men. And so for transgender women going on estradiol, then they're going to increase their risk of osteoporosis based on those sex hormone changes that we're making to be in line with their cis counterparts. And patients are always given a full in-depth informed consent provided prior to. And I will say in the healthcare, and I've also done, I was in family medicine practice for a while, and these patients are determined and they are dedicated. And one of the hardest things in family medicine practice is just getting patients to follow through with the medical recommendations, whether it's diabetes and getting them to take their metformin, or whether it's high blood pressure and getting them to take their antihypertensive and get their labs done or get their physicals. Patients who who are transgender going on hormone therapy are the most consistent and dedicated in terms of getting their labs and getting their hormones and taking things without missing doses, because they are so because this is so important to them. This is not something that is just I have this and I should probably be doing that. No, this is this for many of them is saving them from a lot of distress and a lot of anxiety by being able to have this type of care. And so in conclusion, I just want to say gender identity and sex at birth do not always align. And it's really important that we understand that. And those of us as medical professionals, the vast majority of us understand this. Like I said, the implementation of gender-affirming care for those whose gender does not align with their sex assigned so the implementation of gender-affirming care for those whose gender does not align with their sex assigned at birth is a decision to be made between the patient, family, and healthcare professional. And banning gender-affirming care will likely have catastrophic consequences for transgender and gender diverse kids and adults. And I can speak even just to my own patients and understanding how catastrophic that would be. So that is what I had other things I thought maybe be able to start talking.
Okay, she just froze there for a second. Hopefully it catches up.
Yep, questions at this time, I'd love to answer. Can you still hear me okay?
All right. So
Can you hear me?
I can hear you. Can you hear me? Okay,
Yes.
good. So there were a few questions that came up. Let me go back and see if I can find the first one that I saw was from Mars, and they ask, at what age do children develop their gender and sexual identities?
Frozen a little. I'm sorry, I didn't, you froze on me and I missed the question. At what age, what?
At what age, do children develop their gender and sexual identities?
So actually from a very young age, so like 2, 3, 4 years old, patients are developing an understanding of gender and what their gender is. And as far as the brain and where that's really probably, so that's them kind of coming to terms with what it is. So as far as the brain actually developing, that's really in utero just before and just after birth. And once that's been developed, based on all of these sort of complex interplay of genetics and hormones and receptors and pathways and signaling and all of this stuff that we don't have a full grasp of, but we do know that once that has finally solidified with the brain and your gender, that's pretty much it. And so it's not a all the way here or all the way there, although we have plenty of us who are all the way here and we're all the way there. But there are definitely persons who are somewhere here or maybe even right in the middle. And people who are very comfortable even going back and forth between both, but that really our understanding of our gender and our comfortability with our gender and what then contributes to the behaviors and the characteristics and the roles that we're comfortable with playing, that's set. And that's not something that we can change just by conversion therapy or, telling somebody, no, you're not a boy, you're a girl. That's not cutting it. And we can see that it's not cutting it, especially when we have this unacceptable level of suicidal ideation and suicide among people who are so distraught with their situation and certainly with the way the community has been accepting them or not accepting them.
Mhm. Another question coming from Mars. What is the link between neurodivergence and queerness?
That is actually really fascinating, and I appreciate the question. We do know that there is some kind of link between neurodivergence and queerness, and we don't fully understand it because, and especially like autism and autism spectrum. Now, one of the theories that I appreciate and makes to me, especially, I do have my brother is autistic, and things that make sense to me is it that there is a higher rate of persons who are autistic who are also transgender, or is it that autistic persons don't have that same filter that the rest of us have, where we say, oh no, I get all these social cues, this is not okay for me to be me, so I better not be. And whereas autistic individuals and persons who are on the spectrum have less of that filter, they're just them, they're just themselves, and they're going to be, you know, whether you like it or not, they're going to do what they want to do, they're going to act how they want to act, and they're going to be who they are. And so that is a theory. We don't actually know, but yes, there is a higher rate of persons identifying as transgender or gender diverse who are also on the spectrum and or have some neurodivergence compared to those who do not.
Yeah, you know, I've worked with kids who are on the spectrum, and maybe who also identified as trans or even non-binary. And I kind of agree with you on the latter part. I feel like they're unencumbered with a lot of, like, you know, our hangups that are truly like society's hangups that,
Yes.
you know, whether it's through the patriarchy or whatever, we have internalized and we're afraid to express our full selves. I think that I mean,
Yeah.
I could see that being the connection.
It makes sense to me. Again, we don't know everything, but that
Mhm.
certainly makes sense, not just to myself, but also to a lot of other, you know, professionals of this field. So
Yeah. Mars coming up with all the questions today. They ask, ever hear about those things? And I'm assuming they're talking about neurodivergence and queerness being linked to left-handedness.
oh, that is a question I'm not sure. I don't know. Is it? Does that somebody else know?
Maybe if you do, put it in the chat.
Yeah.
So Phil is pointing out what is happening all over the place. It seems to me that much of the controversy surrounding transgender issues is related to how it impacts the public at large. For instance, people have strong opinions about transgender people using restroom facilities or competing in sports that do not match their biological sex. How do you propose we address those concerns? I'm telling you, please tell me, because I encounter
This
it
is great.
everywhere.
Okay, so let me go back to my PowerPoint because I actually, let me see, PowerPoint, is it this one, share? Okay, so what I said, I was like, oh, I wanted to talk about more things, but I didn't get to it. But anyway, so laws and natural variation. So this is something that I do want to talk about because it's something that I heard from someone who was saying that they were a girl and they were going to be so uncomfortable with a transgender woman coming into their restroom because they would be scared. And then I'm saying, well, so where do we draw the line at who's allowed into whose restroom? Because we know that there are so many variations of people who identify as a woman being very, very big, very, very strong, maybe very intimidating, maybe having high levels of testosterone. I have high levels of testosterone. It's a lot easier for me to build muscle and, like I said, grow a beard if I want to do. And then there's also, you know, people who are cis men who are much, you know, weaker and more docile and not, you know, and maybe also don't have as high levels of testosterone. Also, something interesting to note, a lot of my transgender women, before they ever start hormones, who are assigned male at birth, I should do a study on it, but a lot of them do have low levels of testosterone coming in before they've ever even started anything. So it's just interesting to know. But anyways, going back to this, where do we draw the line when it comes to sports, when it comes to people? So if a girl has congenital adrenal hyperplasia, is a cis woman who identifies as a woman, has this high level of testosterone, has the larger skeletal structure and the muscles and whatever else, do we say, oh no, they can't have, you know, play this game? I just think it's silly to go just only solely based on someone's XY or genitalia, and not I just feel like it ends up becoming an argument that's not a very good one when we look at how varied we are as humans and as human bodies. And I think it's not what I think I wrote something that basically just it's probably gonna freeze for a minute. Maybe there's a girl in a restroom who has a few moments of feeling uncomfortable because she thinks because she doesn't even know that person is transgender. first of all, because bodies are different. That someone who has a few minutes of being uncomfortable being in a restroom with someone who they think are transgender versus that person who has lived their entire lives so uncomfortable with their own bodies, but in a community that just does not accept them, and whose experience is more valid here. Should that woman then go into the men's restroom? That trans woman, does that make any sense? Is that better? Are we protecting our community better that way? No. And also there has been research that has shown that we're in the places where they've enacted these bans, they're not any safer. There's not less violence. And if a man is going to want to go into a bathroom and assault a woman, he's just going to do that. He's not going to get a sex change. He's not going to go on hormones for all of these years. These are not sexual deviants. These are not predators. These are human beings. And so for us as a society to sort of group them and ostracize them and then label them in such a way is just horrific. I can't believe we've been doing this and we've been getting away with it and we've been somehow comfortable with it. And then going on to sports, there are so few transgender people in sports. Do you know personally of anyone in your high school or your league or anything like that? Maybe you do, but a lot of people don't. And when it came to the laws, I think it was in Utah, was it, where the governor, who was otherwise maybe would have been against it, but was like, I don't understand. We're talking about 4 kids in the whole state. Why are we all so upset about this? And then it goes back to my point about women who are born women, who have a vagina, who are playing sports with way more testosterone, a way bigger frame, and way larger muscles. And we're not saying, then there should be some line of like, okay, if you have, are we going to check everyone's body density before they go into a bathroom or before they start, applying to play a certain sport? This is silliness. And I just don't understand why we are so upset about it. And why do we care? Can we just let humans be humans and do what is going to be the best for them, their quality of life, their well-being, their health, and they are not hurting anyone?
Well, I'm currently working on a Substack that tackles why do we care so much about this, everything right now, everything right now goes back to power and control. It goes back to Project 2025, white Christian nationalism, the work that we do here with Secular AZ, because, I heard over and over yesterday when I watched the Peoria Unified School District Board meeting that they were talking about their religious freedom. Well, what about my religious freedom? What about my child's religious freedom to be unencumbered with your stringent stereotypes of men and women, of gender roles? It's really so antiquated, and they all go along together,
and it's
right?
not scientific.
No, that's the most infuriating thing. And that was actually a question that I wanted to ask you. I know we're running out of time, but I think I could talk to you all day. Let's see. How do you combat? Because this is so frustrating to me when they start citing these like faux medical organizations that just popped up over the last few years. Like, and they speak it as if these are real professionals instead of just Christo-fascist bigots. So how do you combat that?
Well, I think what's really interesting, so I'm the nice thing is that I'm not the only one combating this. And so when we look at something like specifically the Cass report, I don't know if you're familiar with the Cass report, but that was a big one that was thrown around. And it was, first of all, written by someone, and actually a group of people who do not do this care to begin with, who were biased. And there were plenty of authors on there that were absolutely anonymous, meaning there was no way to vet them in terms of their religious conflict of interest or intellectual conflict of interest. And that is not how we do things in the medical world or in the professional world, especially when it comes to publishing research or literature. And so I have a lot of great resources for that, because let's see, I'm gonna pull up. I don't know if I can move my stuff out of the way to grab it because I had it here. And my show, there we go. Can you still, you can still see me. But yeah, so there was a group of researchers that came together just to talk about the Cass report, and it was research study. So among our author group, we have, so there's people who've come together who've been able to make some really great points that I like to go back and reference, but it's just, the author group that rebutted it have 86 years of experience in caring for more than 4,800 transgender youth, and have published over 278 peer-reviewed studies, 168 of which are in the field of gender-affirming care. And so they published this critique basically of the CAS review. And I think the CAS review has been used sort of, it's really the only one that's been used again and again.
Lindsay put it, yeah, she put a couple of links in there. So folks, make sure that you click on those links before we shut down this discussion today. Yeah, you know, the bathroom thing too. First of all, the people who are going to be targeted in the bathrooms are most likely going to be cisgender, you know, like non-conforming folks. Like, you know, there's this 6 foot tall lesbian that I follow on TikTok, and she is constantly talking about how she is targeted in the bathroom. And so like, so for, you know, these folks who fight against this and claim to be like, they're targeting people who are using the bathroom that already matches their birth certificate.
Yeah. So do we all have to just flash our way in to just make sure everyone knows what genitalia we have? Does that make any sense? Our bodies are all different. We are all different. As humans, we're different. And this should not be an issue. We should, no. It's devastating.
And I think about too, like there's a couple of celebrities that I follow also on Instagram. Okay, I'm on social media too much. But Laith Ashley is a male model. He's a trans male model. He's got hair all over his body, full beard, you know, muscular. He is so fine. I'll tell you what, but you know, you know, if he were to walk in a woman's restroom, women would lose their minds. Yes. Right. Carmen Carrera is another one. Beautiful, gorgeous model and performer. And you know, if she would be unsafe if she walked into a men's restroom. You know what I mean? Like
exactly. When we talk about safety, we talk about people's concerns for safety, let us understand that the transgender and gender diverse community is at much higher risk of violence against them and against their persons, just in their community, whether it's in their bathrooms or elsewhere. And so compared to the general population. And so to be doing the things that we're doing, we're just saying that not only do we not care, but we're fine with putting you at higher risk than you already are.
Mm-hmm. Well, I'll tell you what, there's a lot of engagement here. People are asking a lot of questions. Some folks have already thanked you because they have to go and get about their day. Other folks are asking if they can watch this later. And yes, it will be posted in the next couple of days. Before I go to the last question for you, I'm going to remind everybody that we are a small but mighty nonprofit. And so your donations really make a big difference. We now have a new development director, and I can tell you that our legal staff is overwhelmed. So even if it's just $5, $10, $20, or if you want to do it monthly, we'll take that too. Please support Secular AZ today. But to end it today, Jessica, first of all, you're awesome. I'm so glad that our paths crossed. This was such a great discussion. I did take a screenshot of the screen you told me to, so I can look at those. I am going to share this far and wide with everybody when I, you know, email my, you know, governing board to either say, please, you know, accept your trans kids, or thank you for protecting our trans kids. I can share this presentation and feel confident that they are getting accurate information. So in the work that you do every single day, considering everything that's going on around us and all the crazy, what is something that gives you hope?
That is a really great question. And I hate that I have to pause as long as I do just because of where we're at right now. But you know what, honestly, it's organizations like yours, and seeing the people who are out there, and like, for instance, going to Pride Fest and seeing all of the different amazing people and organizations who are fighting and who have not stopped and who have not given up and who, you know, are eager to share this information and also eager to listen. I think that's also very encouraging when anyone who otherwise, you know, maybe not be activists, but are listening. And I think that's important, and that gives me hope. So yeah, I pause because sometimes you lose hope when things are looking really, really bleak, you know, but no, and honestly, just this experience alone has given me a lot of hope. So thank you.
Oh, that's great. That makes me really happy. And you know what? This is my mantra. They are loud, but we are many. And hopefully in November, we show everybody just how many of us there are when we reject this kind of narrow-minded anti-science thinking. So thank you so much, Jessica. I appreciate you.
Absolutely. Thank you so much. Great rest of your day. I appreciate it.
Yep. Have a great weekend, everybody. Take care.